Mr. Clerk, can you please read Communication 411.2?
Communication 411.2 requests a presentation by the Mass Transit Agency for an update on passenger statistics, operating expenses, and other measurable data regarding the Helion Kako'o Paratransit Service from Councilmember Sue L.K. Leloy, dated August 29, 2018.
Ms. Leloy, can I have a motion to file?
So moved.
Okay, file. Motion by Ms. Leloy and second by Ms. David. We have from Mass Transit, we have Ms. Tiffany Kai, and I think you're going to do the presentation first, right? Okay.
Aloha, council members. Thank you for this opportunity today to share and provide an update on our Helion Kako'o paratransit services. My name is Tiffany Kai. I'm the program manager for the County Mass Transit Agency. Just a brief history. So the Helion Kako'o paratransit services began in July 2016 in Hilo and Kona. Since the inception of the program, services has steadily grown. Paratransit is an origin to destination advanced reservation service that is required by each public entity operating fixed route services. Paratransit or other special services shall be available to individuals with disabilities who are unable to use the regular fixed Helion bus services within Hilo and Kona areas. Although federal guidelines call for a minimum of 3/4 of a mile of regular service, MTA provides services up to 1 mile off the main corridors of the fixed routes. In addition to paratransit, MTA also provides a shared ride taxi program. The shared ride taxi program is only available in the urbanized areas of Hilo. This successful program is open to the general public and has 7 participating companies. Of the 7, 2 companies offer accessible vehicles. The shared ride program complements the paratransit services by offering services up to 9 miles. Therefore, individuals may use a combination of services. MTA also accommodates disabled passengers by funding for paratransit services through the HCEOC. Services through HCEOC are provided to low-income residents on a pre-screened basis. So, service overview. Eligibility. Eligibility for our services is based upon a person's disability and functional capabilities that make him or her unable to use the regular bus service. An individual who is interested will complete an application, do a short interview, and then complete an in-person functional ability assessment. This process will determine eligibility for our services. 99% of the applicants are always eligible for our services. Basically, we have 21 days to complete the process, but the average time is about a week. Service operations for paratransit are Monday through Saturday, no services on Sunday and county observed holidays, with the exception of Election Day. Since buses operate on Election Day, paratransit operates as well. Service hours in Kona are 7 a.m. to 7:30 p.m. and in Hilo from 7 a.m. to 5 o'clock p.m. So basically for paratransit, it's the same service hours as fixed route services. Our call center or reservation line is open from 7:45 a.m. to 4:30 p.m. Monday through Friday, and riders may leave messages after hours and weekends for next day reservations. Again, so our service areas are only in Kona and in Hilo. So basically 1 mile off of the main corridors from our fixed route. So basically it's Matsuyama store to Captain Cook. And then in Hilo would be Kaumana, Wainaku to Waikio, Kapanaeva area. So here's the service area map of Kona, as well as Hilo. And for a more defined map, it can be found on our website as well. Number of eligible riders. So it looks like Kona still dominates with riders and ridership. Currently, we have 87 eligible riders in Kona and 34 in Hilo. In 1 year, we gained 27 new eligible riders. So as you can see on the slide for the eligible riders, Kona would be on the left and Hilo on the right, and 2018 is in blue and 2017 in green. So there is a small increase in riders, eligible riders, but Kona definitely has more riders than in Hilo. Because eligibility is effective for a 3-year period, in most cases, we will have a number of renewals coming up in 2019 for those who became eligible for services in 2016. So therefore, in March 2019, Mass Transit will begin the process and start sending out renewal letters, application, and reminders to our current riders that their eligibility will be up for renewal. And they would need to go through the same process. One of the common factors that Hilo has a lower ridership is based on the shared ride program, and there's more access to other transportation alternatives. So ridership. Since the inception of the program, ridership has grown by 32.64%. In 2017, we did a total of 1,970 passenger trips, and in 2018, we completed 2,613 passenger trips. For the breakdown in 2018, 2,420 passenger trips in Kona, while Hilo completed 193 trips. As you can see by the chart, there's a trend to the ridership in certain months. For example, July, August, September, as well as December. We also noticed that December ridership decreased in both years of 17 and 18, as well as our regular Helion bus services. We noticed that there's a decrease in ridership during that month, the month of December. We're seeing the same participants using our services, which we call our regular riders, especially those who have been just certified. Majority of the participants are using the paratransit services to access health care. We have also seen an increase in those who are on dialysis. So in this slide, it shows the ridership, Kona versus Hilo, where Kona has a 92.61% ridership and Hilo has a 7.39% ridership. Transportation expenses. Expenses for paratransit did not significantly increase. For 2017, our expenditures for transportation amounted to $245,649, and for 2018, expenses totaled $245,209. Although there was an increase in ridership, it helped to keep the costs down. The reason is the more riders we have filling hourly blocks reduces the cost. So in this fiscal year of, 2018, the cost per ride was $83. As for revenues, MTA collected $10,490 for fiscal year 2018 for fares and paratransit coupons. Mass Transit has a deep commitment to the disabled community, so we participate in various outreach services and events. For example, the National Federation for the Blind, Office of Housing and Workforce Development job fairs, visiting senior housing and programs, as well as the legislative disability forums. We want to engage and help our community by being good listeners and addressing areas of concern. We feel it's vital that persons with disabilities has equal access to transportation and engaging in programs and activities. Exactly what Mr. Fuyaba had mentioned, how he uses our services to access different programs and being active in the community. And that's what we want for this population as well as our aging population, because we know that the baby boomers, they're living longer and they're very well abled. So it's important for them to engage in programs. So some of the service improvements that our contractor does, let me back up a little bit. So Mass Transit currently, contracts with A2B Transportation to provide the transportation services. So they do annual training, and what's included with their annual training, which involves their drivers as well, is CPR, AED, first aid, service animal training, sensitivity training, security, and safe driving. And of course, service animals are always welcome. So where do we go from here? For paratransit services, we're going to support the Transit Master Plan recommendation in service improvements and areas called out by extending hours in both Hilo and Kona in the evening. Included in the Transit Master Plan, we're going to introduce new paratransit type services in Hamakua, North Kohala, South Kohala, Ka'u, and Puna districts. Build ridership in Hilo by continuing to visit agencies, providers, senior programs, and housing. Invest in paratransit scheduling and dispatching software as ridership grows. This will help prepare efficient vehicle schedules. And create a user-friendly mobile app. So support our vision. So Mass Transit is, again, committed to providing a well-functioning and dependable system that is critical to the quality of life for individuals with a disability and their ohana. We see this community growing, and so we need to be cognizant of that and be ready to support the growth. We anticipate that the growth will be an average of 3 to 5% each year for our program and services. We will continue to engage with stakeholders and the community through public workshops and presentations. And that's all I have as far as the presentation. And I'll be happy to answer any questions the council may have.
Okay, thank you very much, Ms. Kai. Ms. Leloy, would you like to have the floor?
Sure. Thank you, Chair. Thank you, Ms. Kai. And I'm going to start with, what our testifier spoke about, which is the ability to expand this program, to provide the services so desperately needed for this segment of our community. And I'll start with Ms. Kai. We recently passed the GE surcharge. How is that surcharge going to be helpful to this program?
The general excise tax will allow this program to grow. As mentioned by Mr. Fuyaba and myself, we do see this program growing, and we do want the participants to participate in programs that will allow them to have a better and good quality of life. So I believe by having the GE tax funding come through, we will be able to expand our services, and not just within just Hilo and Kona, by extending the hours, yes, that's a plus, but also reaching out to the rural areas where paratransit or transportation is not available as frequent as we do have it in the urbanized areas. We're looking and noticing that Pune will probably be the next district that will have these services for the individuals with a disability.
So follow up to that question, how are you folks identifying that measurable? Why Pune? Why not Kohala? Why not Ka'u? How is some of the data that you folks are getting from the requests from eligible paratransit users driving an outcome or a measurable so that this body can help get the funding into those rural areas in a systematic way? Share with me that data or if you have that data, and how these places are being identified in a systematic way.
Well, basically, because we live in Hawaii, we do hear by word of mouth that there are a lot of demand in those areas of Pune. Our next steps for this program is to actually do a survey to see how many people are out there. I mean, in the beginning, when we first created or established this program, we did have some data that we collected from the Disability Council, from the Office of Aging, from different agencies, but we would like to collect more data ourselves to see where these communities are so we can make sure that we're providing the services in the right areas.
Okay, so for that needs assessment, I understand, and we had a great baseline presentation from the previous paratransit coordinator, and there was a survey results on the Heleon Kako'o survey results for Kako'o ridership.
Correct.
Did we do something like that for this year since this baseline was developed?
We actually started doing the survey, I'm going to say last week, so we haven't collected them back yet from our participants.
What's the timeline on that, and when would we be able to get some of that data?
We should have all the survey responses by the end of the month, and maybe 2 weeks to compile that data.
Okay, I wanted to move on something you mentioned during the eligibility of riders. You mentioned 27 new eligible riders and an annual renewal process. I just had a question as to why. Like, why do they have to renew if we've identified them as having a need?
Okay, just to clarify that the renews can be different per participant. The baseline, or we usually go by 3 years eligibility. So prior to their 3 years, before their eligibility is expired, we would notify them. But the reason for them going through the process again is because their status may change. Some people might improve, or their health may decline. So that is the reason why we go through the process again. And it's not to weed out those who their health have, improved. And if it did, well, that's always a blessing. But what we do is just to kind of reassess their eligibility to see if there has been any improvements or decline in health.
That makes a lot of sense. Sometimes they have a broken foot and they need help. So I want to move on to the ridership Kona versus Hilo. And you mentioned that, the numbers are much higher in Kona, but you also qualified that with Hilo has a share ride program. What are those numbers for the share ride program in Hilo? And is there a way to build that number into what we're providing in Hilo?
Yes, so I'm sorry, I don't have the numbers for the shared ride program with me, but I can get that to you. Let me just make a note. And one of
And Tiffany, just to clarify, there's no share ride in Kona, correct?
that is correct.
Do we know why?
I'm going to say that when the shared ride program first came out, we did have participants with the shared ride program. But I believe because Kona is so spread out and the limitations 9 miles, there's no goodness, benefit to the taxi cab operators. But we are looking at ways, being creative perhaps with taxi cab companies to jump on to the shared ride program in Kona. Perhaps if the county has capital funds, or if we do get federal funding, purchasing accessible vehicles for participants, taxi cab participants in Kona, and maybe 50% off, or do some type of incentive so we can draw these taxi cab companies to be part of this program. And getting back to your, go ahead.
Oh, go ahead and finish. It's fine.
So getting back to the first question about the shared ride in Hilo, another reason is the cost difference. For paratransit, it's $4, and the shared ride taxi program is $2 per ride. You can go up to 9 miles, and there's no eligibility as well on the shared ride program. It's open to all.
Do you have the average for the paratransit share ride?
The cost per ride?
Yes. So we have share ride coupons that students can use, but we also have share ride coupons that paratransit eligible users use. Do we have the difference or the breakdown between a share ride coupon user and a share ride paratransit user?
No. So basically, hopefully I can explain this right and if I'm understanding correctly. So the shared ride, or I'm going to say the paratransit coupon user, it's $4 whether they use the coupons or whether they're going to pay cash. And of course, they have to be eligible for the paratransit services. As if you have the shared ride taxi coupon, those are sold for either $2, $3, $2.50, or $6, depending on the amount of coupons you purchase. I'm sorry, I'm hoping that I'm answering your question correctly as far as the breakdown.
No, I'm going to move on, and maybe some of my other colleagues might be able to pick that one back up. You mentioned for the Hilo with the, I guess it's the share ride, there's 7, but 2 have the accessible paratransit. How do we increase that number?
Well, what's outlined in the transit master plan is for those companies who have 5 or more vehicles, is to impress that they need to have accessible vehicles as well. So that is one way we can build additional vehicles for the shared ride taxi program.
Yeah, thank you. Got to start somewhere. And I guess this will be my last question. And just to clarify, I heard you say it's $83 per ride for a paratransit user.
That would be the cost to the county, yes, correct. $83 per paratransit ride, where it would cost the user itself $4 per ride.
And is that like one way per ride?
Per ride, correct.
Okay. Thank you. Thank you, Chair. I yield.
Okay, thank you. Any other comments or questions, council members? No, in Hilo, Ms. O'Hara?
Chair,
Go ahead.
if I may ask a few questions of Ms. Guy.
Can you speak up just a little bit, Ms. O'Hara?
Yes, can I ask a few
That's good.
questions of Ms. Guy? Okay. I am a little confused on this topic of trying to break out the cost per ride. Now, I understand that we have an average cost per transit, paratransit ride. But what complicates the equation is the share ride piece. Now, I'm only seeing the share ride piece in Hilo because we don't have that same service in Kona. But it's hard when you're talking about the cost to the customer, $4, and the purchase of a distance coupon for the ride. It's hard to equate that to the average of $83 per ride for the paratransit. What I'm getting at, Tiffany, is whether or not it's more cost effective to build up the share ride piece, because I'm not clear on what the county is paying for those share rides. I understand what the customer has to pay for that, but what is the county's support on that? Because I realize also that perhaps share ride doesn't work for every client, every customer. Some have needs that require the full paratransit equipment. So I'm just trying to figure out where expansion is best, in the share ride portion in Hilo or with additional paratransit equipment.
I see. Yeah, unfortunately, I don't have the breakdown for the shared ride side per ride, but I do know that the county pays approximately $950,000 annually to operate the shared ride taxi program. But I can definitely get you the cost breakdowns for those.
All right, thank you. I realize that's kind of a difficult thing to break out since we're doing the shared ride for non-paratransit ridership as well. And I'm not sure that we can really break those apart, or if you have a way to do that in terms of how the purchases are made, or there needs to be some qualifier in order to separate out that data so we have that information. Because I think it's really kind of critical. If we're looking at adding services into the Puna district, you said is probably the next area that's most likely to receive paratransit services. And it would also, we would also need the results of the survey that you're just getting started in order to understand why people are requesting the service to begin with, and what kind of ridership we have in terms of what type of equipment is most appropriate. So we need a way to be able to break that apart so we can kind of study that issue right there. Just my thought. Thank you.
Thank you.
Thank you. Any other questions or comments? Ms. Kai?
Final comment.
Oh, Ms. Leloy?
Yeah, Ms. Kai, if you could bring some of that information back at maybe some later date when all of that is in like the surveys and maybe an opportunity to break that out, and share that with the council at some future date. I think that would be very valuable for us. Mass transit has gotten a lot of attention from this body, and we just want to keep everybody on task and focused and, delivering a transit system that everybody can rely on, which, I know and everybody on this body knows to be the goal and the mission of this department. So I look forward to some of that. Thank you.
Absolutely. Thank you. Do you have anything further to add, Ms. Kai?
No.
Okay. Thank you very much. Then, council members, all in favor of filing communication 411.2, please say aye. That would be 6 ayes and 3 are absent. May I have a motion to adjourn? Moved by Ms. David. Second by Mr. Chung. All in favor, please say aye. Okay, we have 6 ayes, and this meeting's adjourned. Okay, thank you very much.